Hello, my name is Stephanie Ortega, and my research is based on music therapy in children with autism spectrum disorder. A little bit of background: for a very long time, I have always gained an interest in working with children with autism, and because of that reason, I decided to do research on different forms of therapy and to see what effects each therapy has on children with autism. And one of the therapies that I found the most interested in was music therapy, which is a clinical and evidence-based use of music interventions to accomplish individualized goals within a therapeutic relationship to address physical, psychological, cognitive, and social needs of individuals. Um, and the reason why I think this is a very unique and very effective therapy for children with ASD is because it truly does a lot more than just enhancing a child's cognitive skills. It's also known to lower their stress and anxiety levels, which is something that they have to deal with in their everyday lives. My research question is, what are the effects of music therapy on children with autism spectrum disorder? And the question in the answer that answers my question is, multiple studies have been performed to prove that music therapy does help a child with their social, communication, and behavioral challenges. And then the bottom is just it's apart from my report, and it is it is mentioning one of the articles that helped answer my question. The three assumptions that were made throughout my paper is one of them being that incorporating music therapy into the ABA-VB approach, children with autism are more likely to develop communication skills sooner. Second, setting goals for the child helps the child and parent have something to work towards and eventually see results. Third, although not on the spectrum, incorporating music therapy into the lives of aphasia patients prove the effects of music therapy and how it can be seen as a universal form of therapy. And then the three these three highlighted things are from my article mentioning the three assumptions. Prior to research, based on the research, it was said that a parent's involvement in the therapy session showed great improvement in the child's ability to communicate at home. Setting a goal for the child during therapy was very effective. Therapists noticed a rapid change in the child's cognitive skills, and of course, this varies in each child, just because with some children it can take a longer time, while in others it just takes a shorter amount of time. And then through the eyes of the child, this was not just some other treatment, this was something that they found entertaining, yet they were gaining very valuable skills. Erasing my opinion, there was no hardship when it came to writing my paper. The only thing that I found difficult was to not include my opinion in parts of the paper where my opinion should not have been included. Another difficulty that I stumbled upon was not to write in the first person, so like using I throughout the report. This was a lot more difficult while writing my introduction and my subsection, just because a lot of the times I did feel kind of awkward just not writing in first person, so that was very hard for me. Implications. Music therapy can be considered as a valuable form of therapy for children with autism spectrum disorder. It helps improve their cognitive and behavioral skills. Also helps enhance joint attention, which is often helpful in the classrooms. Different ways that music therapy can be incorporated into the children's lives are in the classroom, home, clinic, or hospital setting. Recommendations. Music therapy, I think, should be included in classrooms as part of the child's learning and not just for studies. I think it would be a lot more valuable for children to have music therapy in their everyday lives in the classroom, and just take like an hour or two to do something fun and something that they enjoy, but at the same time they're gaining skills that they'll be using for the rest of their lives. I think music therapy should also be an option to any patient that struggles with verbal skills, and for example aphasia, which is not on the spectrum. It is not any type of autism. So I feel like anyone who struggles with any verbal skills should have music therapy as an option. More research, of course, should be made on to see how effective music therapy is on teenagers and adults. I didn't really see a lot of research made on that. Most of my research mainly focused on children from the ages 3 to 5, no older than maybe 7 years old. So it would be really interesting to see if people like teenagers or adults who have never been exposed to music therapy, if it has the same effect that it does on children who um, take in stuff a lot faster than adults, and what it matters and where it should be applied. My research would be valuable to parents who are interested in music therapy for the child with ASD. It can also be applied to other research to make a comparison between music therapy and another form of therapy for children with ASD. This information can also be useful in a clinic or hospital setting in order to inform parents of the effects of music therapy. And this is the last slide of my presentation, and that's about it.